By the time a blocked artery shows symptoms, over 70% of the damage is already done. That's not just theory. That's what a 2023 report from the American Heart Association found when they analyzed over 200,000 heart scans from older adults across the U.S. And here's the part that keeps me up at night. Most of those people felt fine, right up until the heart attack or stroke. Now, I'm not here to scare you. That's not my style. But if you're over 60 and you've felt a little more tired than usual, had cold feet more often, or noticed your blood pressure creeping up, this is your body trying to get your attention. I'm Dr. James Porter, and if this is your first time on the channel, I'm glad you're here. I share practical, science-backed ways to protect your brain, your vision, and your heart, especially for adults over 60. So if that's you, consider subscribing. You won't regret it. Now, let's talk about your arteries. These blood vessels carry oxygen to every cell in your body. They're supposed to be smooth and elastic, like a garden hose that bends and flexes as pressure flows through. But over time, that smooth inner lining can get irritated by things like high blood sugar, processed fats, or even chronic stress. Tiny cracks form. Your body tries to patch them up, using cholesterol, calcium, and platelets, and little by little, that flexible hose starts to harden, thicken, narrow. This is called atherosclerosis. And once it starts, it doesn't just affect your heart. It can cut off blood to your brain, your kidneys, your legs, even your eyes. But here's what most people don't realize. Your body also has the power to heal. It wants to repair those arteries. It wants to restore that flexibility. And the good news is, you don't need exotic treatments or expensive supplements to get started. In fact, some of the most powerful artery healing tools are already in your kitchen. In the next few minutes, I'll walk you through 3 incredible foods, often dismissed as just snacks, that can actually help your arteries fight back. Not in theory, but in real, measurable ways. Let's start with the one shaped like your brain, and just as smart for your heart. Let's start with a food that looks like your brain. And just like your brain, it's full of hidden power. Walnuts. Small, wrinkled, unassuming. But when it comes to healing your arteries, they are one of the most researched and most effective tools nature has to offer. You see, after the age of 60, your arteries slowly start to lose their elasticity. What used to be soft and flexible becomes stiff, thick, and narrow. And this isn't just about blood pressure. Stiff arteries limit oxygen delivery to your brain, your legs, your heart. They turn a healthy pulse into a silent struggle. But walnuts help reverse that. In 2021, researchers at the University of California followed over 700 adults between the ages of 63 and 79 for 2 years. Half of them ate a handful of walnuts every day. The result? Lower LDL cholesterol, better blood vessel flexibility, and improved endothelial function, the part of the artery that controls expansion and blood flow. And that's not the only proof. The Journal of the American College of Cardiology published a study showing that just 4 weeks of walnut consumption reduced markers of inflammation by 12% in older adults. Inflammation is what triggers damage to artery walls. Less inflammation means less damage, less plaque, and better circulation from head to toe. So how do walnuts do all this? They contain a powerful plant-based omega-3 fat called alpha-linolenic acid. This helps reduce blood clotting by making platelets less sticky. They also contain L-arginine, which increases nitric oxide, a natural compound that relaxes the inner walls of arteries. When nitric oxide rises, arteries expand more easily. That means lower blood pressure, smoother flow, and better oxygen delivery throughout your body. Walnuts are also rich in antioxidants, like polyphenols and ellagic acid. These help fight off oxidative stress, the same kind of stress that stiffens arteries over time. In short, walnuts soften, protect, and clean your arteries, all in one small package. Let me give you a simple example. Mary, a 72-year-old widow from Georgia, added 7 walnut halves to her oatmeal each morning. After 8 weeks, her doctor noticed her cholesterol had dropped 11 points, and her circulation test showed a 9% improvement in blood flow to the legs. That's not a miracle. That's biology. Now, how can you start? Use raw or dry roasted walnuts. Skip the candied, salted, or flavored kinds. Stick with 6 to 8 walnut halves per day. That's enough. Sprinkle them over your cereal. Blend them into a smoothie. Or eat them whole as an afternoon snack. One more tip, don't throw away the skin. That thin, slightly bitter layer is where many of the antioxidants live. It's simple, it's powerful, and it works best when you do it consistently. Walnuts are not a cure, but they are a tool. And when used daily, they give your body a fighting chance to repair the damage gently, naturally, and over time. In the next part, I'll show you another nut with a different strength. It doesn't just protect your arteries. It defends their inner lining, where healing truly begins. If walnuts help soften the arteries and restore flexibility, almonds play a different but equally powerful role. They protect. More specifically, almonds protect the inner lining of your blood vessels, known as the endothelium. This lining acts like a traffic controller. It tells your vessels when to expand, when to contract, when to stay calm, and when to heal. But in older adults, the endothelium becomes more fragile, damaged by sugar, oxidized fats, chronic inflammation, and even the natural wear of time. That's where almonds come in. Packed with monounsaturated fats, vitamin E, magnesium, and flavonoids, almonds are a natural defense system for aging arteries. But let's talk science. In 2015, a clinical trial published in the journal Free Radical Research found that daily almond consumption improved vascular reactivity in healthy middle-aged men and women. Vascular reactivity is your blood vessel's ability to respond to stress. Better response means better blood flow. And better blood flow means more oxygen reaching every cell, including your heart, your brain, and your muscles. Another study in the Journal of Nutrition in 2016 showed that participants who ate almonds daily for 6 weeks saw a 14% reduction in oxidized LDL cholesterol. This form of LDL is especially dangerous because it's more likely to stick to artery walls and trigger plaque buildup. Almonds helped reduce that threat significantly. But it doesn't stop there. Almonds are one of the richest food sources of natural vitamin E, a fat-soluble antioxidant that protects your arteries from oxidative stress, the process that stiffens vessels and accelerates aging. Unlike synthetic supplements, the vitamin E in almonds comes with all 8 natural tocopherols and tocotrienols, making it easier for your body to absorb and use. The magnesium in almonds also plays a quiet but crucial role. Low magnesium levels are linked to increased risk of hypertension and vascular calcification, especially in older adults. Just 1 ounce of almonds gives you around 76 milligrams of magnesium, which helps relax the smooth muscles in your blood vessels and maintain steady flow. There's also a fiber benefit. Almonds contain soluble fiber that binds to cholesterol in the digestive tract and helps remove it from the body before it enters the bloodstream. Over time, that means less pressure on your arteries and a slower buildup of plaque. What makes almonds especially valuable is how gentle they are on the system. They don't cause spikes in blood sugar. They don't trigger inflammation. And they are remarkably easy to incorporate into any routine. You can eat them raw, lightly roasted, slivered into oatmeal, ground into almond butter, even soaked overnight and blended into smoothies. As long as you avoid the sugar-coated, salted, or overly processed varieties, almonds can become a daily part of your artery support plan. Researchers at King's College London published a review in 2020 confirming that tree nuts, especially almonds, consistently lower total cholesterol and improve endothelial function, especially in people over 60. And that's the point. You don't need massive interventions to protect your arteries. Sometimes, it starts with what you put in your hand at snack time. Walnuts help loosen and relax hardened arteries. Almonds help shield them from further harm. And in the next part, we'll explore a tiny seed that does both, while quietly improving blood pressure and circulation from the inside out. So far, we've seen how walnuts can soften stiff arteries. and how almonds defend the fragile inner lining from everyday damage. But there's one more food, smaller than both, that works silently, consistently, and deeply. Flax seeds. These tiny brown or golden seeds don't look like much, but inside, they contain one of the most concentrated sources of plant-based omega-3 seconds, soluble fiber, and lignans, a rare group of anti-inflammatory compounds with powerful effects on blood vessels. The most important component in flax seeds is alpha-linolenic acid, or ALA. ALA is a plant-based omega-3 fatty acid that helps reduce chronic inflammation inside the arteries. Inflamed arteries are more prone to plaque buildup, restricted flow, and clot formation. By calming the inflammation, ALA helps restore a healthier environment for your blood to move through. In a 2013 study published in Hypertension, researchers from Canada tested the effects of flaxseed on adults with peripheral artery disease, a condition marked by poor circulation and narrowed vessels. After 6 months of eating 30 grams of ground flaxseed daily, participants saw their systolic blood pressure drop by an average of 10 millimeters Hg. That's a bigger drop than most people get from medication without the side effects. Blood pressure is one of the most important markers of arterial health. Lowering it even slightly can drastically reduce your risk of heart attack and stroke, especially after 60. But flax seeds don't stop there. They also contain lignans, which are compounds with antioxidant and estrogen-like properties. Lignans have been shown to reduce oxidative stress, improve lipid profiles, and protect against arterial stiffening, especially in postmenopausal women. Then there's the fiber. Flax seeds are high in both insoluble and soluble fiber. Soluble fiber binds to cholesterol in the gut, dragging it out of the body before it can be absorbed into the blood. This is the kind of slow, daily cleansing that the body depends on. One woman, 68, started adding ground flaxseed to her morning smoothie. At her next checkup, her blood pressure was lower, her cholesterol had dropped, and her doctor said her circulation had improved for the first time in years. That's what flax seeds do. They don't shout. They work quietly. But if you want the benefits, you have to use them the right way. Whole flax seeds often pass through the digestive tract untouched. To unlock the nutrients, you need to use ground flaxseed. Buy it pre-ground or grind it fresh at home using a small blender or coffee grinder. Aim for about 1 tablespoon per day. You can stir it into oatmeal, blend it into yogurt, or mix it with water and lemon as a simple morning drink. The key is consistency. Research published in Nutrition and Metabolism in 2015 showed that daily flaxseed consumption over 12 weeks reduced LDL cholesterol by 15% in adults with high cholesterol. And that was without changing anything else in their diet. No fancy pills, no extreme diets. Just a seed? Flax seeds won't erase decades of damage overnight, but they will help your arteries move better, breathe better, and carry life to the places that need it most. In the next part, we'll bring all 3 foods together, walnuts, almonds, and flax seeds, into one simple, doable routine you can start this week. Because knowing is not enough. What matters is what you do next. Now that you know what each of these powerful foods can do, the next step is turning that knowledge into a daily habit. This isn't about overhauling your entire diet. It's about adding just a few small things each day, the kind of changes that fit into your life, not fight against it. Here's a simple plan to help your arteries heal, gently and naturally. Morning. Start your day with breakfast that includes ground flaxseed. Just 1 tablespoon is enough. Stir it into oatmeal. Sprinkle it over whole grain toast with nut butter, or blend it into a smoothie with berries and plant-based milk. This gives your arteries a clean, anti-inflammatory start to the day, and it helps your digestion too. Midday. Around lunch, reach for almonds. 10 to 12 almonds, raw or dry roasted, unsalted. Eat them alongside your salad, or keep a small container with you for an afternoon snack. The healthy fats and magnesium will help support blood pressure and energy without spiking blood sugar. Evening or dinner. Add walnuts to your final meal. 6 to 8 walnut halves is all it takes. Toss them into a salad with olive oil and lemon. Crush them over roasted vegetables, or enjoy them plain after dinner. This late-day dose of omega-3 seconds supports artery repair overnight when your body does most of its healing. If you follow this rhythm, flax in the morning, almonds by day, walnuts by night, your arteries get a steady stream of support around the clock. You don't need to measure perfectly. You just need to be consistent. Set out small bowls or jars in the kitchen so they're visible. Put reminders on your fridge if needed. Turn it into a ritual, not a chore. Within a few weeks, your blood pressure may feel more stable. Your circulation might improve. And your energy could return in ways you haven't felt in years. None of this is extreme. It's simple. But simple works when done daily. And in the final part, I'll remind you why this matters, and why it's not too late, no matter where you are right now. No matter how long your arteries have been under pressure, no matter how many years of stiffness, fatigue, or poor circulation you've lived through, your body still wants to heal. Even after 60, even after 70. The walls of your arteries may be worn, but they are not beyond repair. And the moment you begin feeding them the right tools consistently, gently, and with care, change begins. This isn't about chasing perfection. It's about giving your heart a little help, a little softness, a little space to breathe again. 3 simple foods. 1 daily rhythm. No gimmicks. No extremes. Just the quiet work of repair meal by meal, day by day. And if you're someone who's tried everything and still feels stuck, I want you to hear this. You are not broken. You are not too late. There is still life in your heart. There is still strength in your veins. And there is still time to take the next right step. If this video gave you something useful, something that made you feel more hopeful, more clear, or more in control, I'd love for you to like it, share it with someone you care about, and leave a comment below. Tell me what change you're starting today. Tell me what part spoke to you most. Your words might be exactly what someone else needs to keep going. And if this is your first time here, welcome. You're not alone anymore. Consider subscribing. There's so much more I'd like to share with you. Thank you for staying with me until the end. I'm Dr. James Porter, and I'll see you in the next video. Until then, be kind to your heart. It's still listening.